Hi, my name is Dr. Tim Lind, and today I'm going to talk a little bit about a question I hear a lot people ask me is dealing with thyroid problems. How come my thyroid's not working, or what caused it to happen? There are a lot of different causes for the thyroid to malfunction, and what people need to understand, first of all, is most of the time thyroid malfunction is secondary to other things going on and other things that are seldom looked at. So we're going to talk about three things here today. We're going to talk about the three primary things that I see in here in my office. So the first thing that can cause the thyroid to malfunction is dysglycemia. Okay. The second thing can be gut malfunction. And the third thing can be adrenal gland malfunction. So we're going to talk about those things. So let's talk about dysglycemia. What is dysglycemia? Dysglycemia basically means that your blood sugar levels is either too high or too low. And glucose is very, very, very important in our body, and it's also very directly related to our thyroid function. There's different types of dysglycemia. If it's too low, it's called hypoglycemia. If it's too high, if it reaches actually a certain level, if your glucose levels gets to 127, then you're diagnosed with diabetes. It can be above the normal range, but not yet quite diabetes, and that's called syndrome X, or insulin resistance. So what happens in this case is our body will not process the sugar properly. So we can have these surges of insulin and sugar, and our system gets all messed up, and that will lead directly to thyroid problems. Very, very important, and you always got to look at the blood sugar levels and dysglycemia in somebody that is having thyroid condition or thyroid symptoms. The next thing is gut malfunction. There is a condition known as Hashimoto's thyroiditis, and that is the most common. About 70% of people in the United States that do have thyroid problems right now do have Hashimoto's, and what Hashimoto's is, it's an autoimmune disease. What people don't know, first of all, the gut is almost always overlooked, and especially thyroid conditions. It's in a lot of different conditions, but it's overlooked a lot, especially in thyroid. What people don't understand is the majority of our immune system is in our gut. So if we got gut malfunctions, that can also lead to immune system malfunction. And if Hashimoto's is an immune system condition, we're going to have a direct relationship there. So the gut is very important to look at. The third thing is adrenal glands, and the adrenal glands are our stress glands, and they, once again, they're also very, very closely related to the thyroid and thyroid function. And if we're under chronic stress, or our adrenals are stressed out, in today's day and age they are an awful lot, that will lead to too much or not enough production of adrenal hormones, which once again will mess up the thyroid. Incidentally, a lot of symptoms that people have with thyroid, which is a chronic sluggishness or tiredness, or even insomnia that go along with that, that is directly related to the adrenal glands. So the adrenal glands definitely have to be evaluated when dealing with thyroid issues. Those are three primary things that I see in my office. There are many, many more that cause thyroid malfunction, but the important thing that people need to understand is most of the time thyroid malfunction is secondary to something else.